Good morning, my name is Kristen Brooks, and on behalf of the Santa Clara County Office of Education, I'd like to welcome you to this webinar from the Supporting Inclusive Practices event titled Implementation, Evaluation, and Phase 4. Joining us today is Jason Stricker from Sanger Unified School District, and he is going to be our presenter for today. Hopefully those of you who are participating today and those of you who may be logging on in just a minute or watching this at a later time, this presentation as well as his PDF will be available to you immediately following the event. For those who registered in advance, the PDF was already sent to you through the OMS system. So without further ado, I'd like to go ahead and welcome Jason Stricker, and thank you so much for presenting for us today. Some much needed information, and we're very excited about what you have to share. So take it away, Jason.
Kristen, thank you for this opportunity this morning to talk about our preschool journey here in Sanger. I do apologize for my voice. I have my tea and water here and we'll make it work. But I want to talk today a little bit about a continuum of preschool services that we have had here in Sanger that are really intended to help facilitate that terminal goal of our children walking into kindergarten with the fewest number of services they need. Briefly, I have been a project manager here in Sanger since 2010, and from 2011 to overseeing preschool. Something that seems to be changing for us is the needs of our 3-year-olds as they come to us from Part C to Part B, or just referrals straight from parents about the intensity of needs. So in my title about from looking at an adult, we have had some kiddos that with no disabilities or a label of autism really cannot look at an adult when they're asked to. And creating programs for those students to then line up for kindergarten and have a successful transition. So I want to talk a little bit about that. I'm just a representative of a bigger preschool team. Our director, Kimberly Salmonson, and our superintendent, Matt Navo, have been very valuable and have put a lot of time and energy into making resources available for preschool. And then over the years, some of the programs that I'm going to talk about were really the brainchild of speech therapists in our district, Kathy Skelton, Sarah Flanagan, and then my current team, which is Dr. Leslie Farlow is the school psychologist, and Amy Visser is the speech therapist. And then Valerie Villagomez is our nurse. So these folks are really the reason why the tools that I'm going to present on today have been created and are being used. Oh, I don't have control.
Let me make sure you have that. There you go.
There we go. So as I said, we're going to talk a little bit about our journey, our resources for preschool. And then I want to spend some time on a tool that we've been using pretty successfully to help us determine what is an appropriate placement for our preschool students. And then also talk about 5 constructs of what we're using when we talk about FAPE, both in our preschool services and for the kindergarten transition. And I'll end with a case study about a kiddo that is a good example of a student that has moved through our continuum of programs. It's not advancing. There we go. So briefly about Sanger. Sanger is a town of about 25,000 residents. We have 11,800 ADA. It's a high need area, 76% poverty. 16% designated as EL, which is a significant decrease for us. We have 14 elementary schools, a comprehensive high school and an intermediate school, and then our Alta Ed and our charter sites. We pretty much stay right around 8% special education. That's been very stable for us for the last 3 years. Presently, we're at 7.8%. This is longitudinal data of our referrals and assessments from preschool from 2009 to 2000 present, or to present. Our Part C referrals, we are not a vendored agency with Regional Center, so we're part of, in the regional area of Central Valley Regional Center, but we do not have a vendor code for them for 0 to 3. But we have a very good relationship with our vendors around us. We're part of a SELPA. We're part of Fresno County Office of Education, and our 0 to 3 services are part of Kings Canyon Unified's vendorization. So the red squares there, for the most part, are coming from our Casey Kids program. They're in Kings Canyon Unified. Our offers, the blue squares, or blue diamonds, we are a district that is growing. Housing is something that has been very affordable for us here in the Central Valley, and Sanger is a district that continues to grow. We've had about 1,588 change in the last 2 years, and we're expecting another 500 in the next year. But what has come with that is an increase in our 0 to 3 and Part C to B evaluations and initial offers. What we're very excited about at the bottom there is the number of students that we've had an increase in who are exiting special education after 1 or 2 years of services prior to kindergarten. And so that 2016 number of 7, that is, so far this year, we've had 7 students exit special education and are on their way to kindergarten because of the growth that they've made with diagnoses of speech and language impairment and autism. There we go. Our continuum, we do have programs in our continuum that are Fresno County programs. So you can see the breakdown of our 93 IEPs at present. That consists of 10.5% of our IEPs in the district are our preschool children. I'll talk very specifically about PALS and our CARS program and the full inclusion preschool program. But PALS is a program that was started in 2007 as a response to intervention program for young children who needed language intervention. As time's gone on, the need has been so great that this is the first year that we have not had students in PALS that are not on IEPs. So PALS this year for us has become an all special education program. Although that doesn't have to be the case, it is the case this year. So 93 IEPs, and within our PALS program, we have 4 different classes that a student can participate in. They go twice a week for an hour. So it's a Monday, Wednesday, or Tuesday, Thursday schedule. And in that program, there's a speech therapist and 2 instructional aides. For the district, resources that are allocated to preschool, we have 2 district speech therapists. One is the full-time therapist in PALS, and we also have a second full-time therapist who is responsible for all of our assessments. And then we are contracting with an agency for speech services because of the demand of assessments at the moment. Currently, we have 4 of our 11 speech therapists that are homeschool therapists who are providing preschool services. We have a special education teacher in our CARS program. There are 6 paraprofessionals across 3 programs I'm going to speak to. And then I already mentioned our psychologist and our nurse. Our preschool services really are in a partnership with our state and district preschool classrooms. We have 14 state and district preschool classrooms across the district. 6 of those classrooms are district-run preschools. The curriculum is all the same, but they are not income-based. So we have our state-run preschools that are income-based, and each class has a teacher and then 2 assistants in the class. These are 3 of the driving questions that really help us make decisions every day about the kiddos. So what does the child need today to access kindergarten in the future? Is the child ready to move to a different class? So as we talk about the continuum, our expectation is that a student would receive services in a particular class just long enough to meet the requirements to graduate from that class and then move into a different class. And then what supports will the child continue to need in general education kindergarten? So it's not uncommon in a year for a preschool child in our district to have 2 or 3 IEP meetings with change of placements into programs that are closer and closer to that terminal goal of kindergarten. So if you receive the handouts, this is an example of the rubric that we use, or the matrix that was developed. We are in the 3rd version of this. Amy Visser, the speech therapist at PALS, and Leslie Farlow were a big part of developing this. But this tool is what we use to kind of get a quantifiable definition of where students are. So communication, and then school readiness, and safety and social skills are domains where just on a very basic 0 to 2 scale, the therapists rate the students on these domains. And then this tool is part of what we use to help us make a decision about placement. This tool has also been very helpful in our meetings because in having a strengths-based conversation in our IEP meetings, this has been helpful for staff to get a sense of what do we really want to highlight as far as strengths of the student. And then also for establishing baseline for goals, we really recommend that if a student is only doing something 0 to 29% of the time, maybe that's not a goal that we could meet in a year. Maybe we want to set a goal that's happening 30 to 69% of the time because it's not in their repertoire, it's not happening more than chance, and we want consistency in the children's responding. So this tool, you have it in the packet, but we basically get a percentage of points across the constructs, and then based on the scoring, we think about placement considerations. And this has been really helpful for us to define the programs ourselves and really help us explain to someone else why a particular program may meet a child's needs at any one time. So I mentioned the PALS program a few times. PALS is Preschool Articulation and Language Service. PALS was first developed in 2007 from some early First Five funds. It was funded from 2007 to 2009 with First Five monies. And then after 2009, the district really needed to make a decision if it was going to continue the program. And because it was a program that was really supporting students that may or may not be identified, but were providing those language services, it was something that really became just part of our continuum and continues to run. At any one time, it has between 40 and 60 students, 3 to 5 year olds running through the PALS program. So this year, we do have one speech therapist and 2 aides, and then a psychologist as part of our, what we're calling a pivotal response training class. It's 2 hours a week, and typically a PALS offer would be twice a week for a year. So we would be offering a student 50, 60-minute sessions or 3,000 minutes of speech in that IEP on this schedule. The 4 classes, you see them described there: the pivotal response class, first words, our language and phonology, and then just a phonology class. And the one is one speech therapist with up to 9 children, and then with 2 aides. So that's the 1, 9 to 2. In your packet, you have descriptions of the program. You can see that in our continuum, the PALS PRT class is really for those students that have the most limited readiness skills. And it may or may not be the case that the student is meeting eligibility under intellectual delay or autism. We do have speech and language impairment only students, yet safety or readiness are so impaired in those children that they really need a student-driven class that is really focused on getting them requesting using whatever modality they can, and also just listening to an adult. We really have had good results with getting them into the PRT class. And in many cases, the students don't spend more than 3 to 6 months in the PALS class or in the PRT class before we're looking at some other class for them. But back to the rubric, rubric scores for the PRT class would be, students would be only scoring up to about 25% of the points available on the rubric, to give you a sense of kind of where those students are. So our PRT class is really a 1-to-1, 1 student, 1 adult ratio, and they're rotating through centers. But the expectation is that children are starting to learn that what an adult says is something that I need to attend to, and that my words are important, my words matter. In addition to the communication challenges, we also really have a lot of students with pretty significant disruptive behaviors in the program. And those are also worked on simultaneously, knowing that with very young children, as language emerges, in many cases, the intensity of disruptive behaviors drop down. And that's been our experience. So the first words class, this would be for students that really are speech and language impairment students that have less than 50 words. Their percentages on the rubric, we have an average score. This was from last year of 50 points out of 150 points possible. And you see that we have exclusion criteria where they have more than 50 words. There's no vocal or motor imitation. And safety is a high concern. those students would be students that we would probably look at PRT for if there's no vocal or motor imitation and safety is a high concern. Or they're using more than 2-word phrases. First words would not be appropriate for that group. Instead, the next class would be the next language class, 75 to 100 words, which really, if our speech therapist were sitting here, she would really say that once a student has about 100 words, then we can really start working on phrases. And so 75 to 100 words. Their classroom readiness is really emerging. That turn taking and using reminders, verbal reminders for transitions, and they're able to attend to an activity for between 5 and 10 minutes would be where we would be with our language class. The next class in PALS would be the phonology and articulation. So these students would be kind of moving in the direction of, when I talk to parents about this, we're really talking about almost physical therapy for the mouth for specific kinds of sounds. And again, we have 1 speech therapist, up to 9 students and 2 aides, and they're rotating through about 15-minute sitters. Our percentages on the rubric are very high. They're meeting most of the points. In most cases, these students are in another concurrent preschool program, like our state-run preschool or district-run preschool. And for all of these programs, here in Sanger, our state-run and our district-run preschools are 3 hours a day, and there's an AM/PM option. And so we also have an AM/PM option for all 4 of the classes that I just mentioned. So a child could go to state-run preschool, but then come to PALS for language services and not miss any general education minutes. And that's something that we're very fortunate to have the flexibility to offer our parents. So each of the 4 classes that I just went through are twice, there's an AM and a PM option. And so that really helps us find flexibility for parents to come and really make sure that their students are getting the services that they need. Exclusionary factors for this class, if we have high safety concerns, intense disruptive behaviors, or there's severe delays in their receptive language, they may be appropriate for a different class. So our next class, this is something, we're calling it our CARS program. And CARS really is for students that may have an intellectual disability or autism, and they are some other global delay. And the preschool rubric, they really have less than 50 points on the rubric. These would be students that as they're walking into kindergarten, and this is really what prompted the conversation, was in our framework, we have our SDC programs in kindergarten really are for children that have cognitive delays. And we didn't really have something for preschoolers. So PALS was meeting some of their needs, but we really needed something that was more intense. And so the communication and academic readiness class is 4 days a week, 2 hours a day. And I assure you that by the end of that 2 hours, those kiddos are really tired. But it comes 2 hours a day, 4 days a week. And there's a special education teacher, 2 aides, and the class is really capped at about 6 children. So again, we're really focusing on readiness, and there's, it looks like a kindergarten classroom or a preschool classroom, but we are looking for a lot of those readiness skills that would help them kind of be ready for something else.
Jason, we have a quick question from the audience. So the question is, the participant was under the impression that PRT requires the participation of typical peers. So wondering how you're using that system if those typical peers aren't available.
So The trademark PRT definition has the components of child-led, adult-facilitated, looking for opportunities for the child to mand or the child to request. And then when those opportunities are available, having them use those skills in typical environments. The acronym is not exactly the best description of what we're doing, because in the PRT class, it is children that all have IEPs. Some of the kids are coming out of in-home ABA programs that are eclectic PRT discrete trial programs. And so it is a bridge for us to move them away from such rigid discrete trial training models into a more eclectic model that still really allow the kids to drive what's going on, so they're motivated to participate. But in no way am I saying that Kegel and Kegel's PRT is the way I'm running it, the way they're running it in that class. It's just the best description for the child-driven request training that we're really focused on. So in your packet, you should have our expectations for CARS. This is a slide that really along those domains of safety, independence, social skills, academics, and communication. These are the behaviors that we would really like the students to work on. And once they're demonstrating these skills, are they ready for something else? Are they ready for a state-run preschool program with support? Can we get them ready for something that is less restrictive? And when we're really looking at pivotal skills or high leverage behaviors, we were able really to reduce it down to just this one-page bullet point list of skills that would say, if we can check these things off the list, the student would be ready for something like a full inclusion preschool or a PALS class with state-run preschool to get them ready. But CARS is our most intensive program before we start talking about our Fresno County Office of Education classes where we could focus on these verbs. This list of verbs was really generated by the preschool teacher, the psychologist, and the speech therapist. And we really refined it with the matrix that I went through to say, if we can get the kids doing these things, then when we come back to the matrix, they are ready for something else. So then the other program, as we keep moving through our continuum, and in your packet you have we're moving up the scale here to our full inclusion preschool. And so our full inclusion preschool program is for students diagnosed with autism specifically. And this program started in 2008 it was really a collaboration between special education and state-run. And our director, Donna Silvera of the state-run program, she really was very excited about the opportunity to open a classroom that had 8 typical developing students who did not have IEPs. And then we placed 4 children with autism in that program. And that started in 2008. And as the need and the program has expanded, today we have an AM/PM class with 10 children who do not have an IEP and 5 children with autism. So we're running 15 students at a time in a class. 5 children do have a diagnosis of autism. There really is a range of cognitive delay in addition to autism. We do have some students that are on the lower end of the spectrum. If they have a diagnosis of intellectual disability, that is not an exclusionary factor. However, they may be more appropriate to stay in our CARS program and continue getting some readiness before going to something like the full inclusion preschool. This program has really been the springboard for our general education placements. So the full inclusion preschool operates 5 days a week, 3 hours a day. There's a teacher and 2 aides. Special education is funding that early education teacher and the early education aides. And then the case management for IEPs for the students with autism is from the speech therapist. And then consultation and goals are also in place with the school psychologist as necessary. One of the things about all of the programs that I've described is that we have weekly professional learning community meetings, PLCs, and we discuss all of the kiddos. So weekly we're having meetings to go case by case through kids and talk about areas of growth, things that they need, really talking about, is a student, really approaching that conversation of, are they ready for another class? And thinking about how are we getting them ready, again, with kindergarten as the terminal goal. This program, the full inclusion program, is a picture-based classroom. So the students with autism, as long as they need it, are using visual schedules and moving through their day really to protect their independence and help them be moving more and more in the direction of just responding to the verbal directions from adults, maybe with some gestural cueing or some signals with transition slips, things like that. But the students really are becoming more and more independent. They do have expectations that they go to all of the centers. And there is a literacy center that is part of our state-run and district-run preschool programs that all students have to participate in every day. And actually, that's probably the favorite of most of our students with autism in that program, because it is more structured. But that's not really a goal for many of those kiddos. Reading and literacy is usually a strength for that group of kids. It's the playing creatively and playing with friends at the other centers where most of our time and energy is focused.
Jason, we have a question from the audience.
Yeah.
And the question is he saying a general ed teacher with 2 sides, I think that means aides, and only SLP as special ed for full inclusion preschool, or is the teacher also special ed credentialed, I'm thinking?
The teacher is not a special education teacher. So every day, the psychologist and the speech therapist are in there for some period of time. But the case management is from the speech therapist, but the teacher is a general education early intervention or early education teacher.
Got it, thank you. And then
special education is just paying for it.
And just a reminder for our participants there, I saw some hand raising, and just please go ahead and use that Q&A feature so that we can get your questions out there. If you just look at the bottom or the top of your screen, depending on the orientation of your device, you should see something that says Q&A.
All right. So to the next slide. So the driving questions of the day, but then our driving questions for changing placement really, again, can be reduced down to the verbs, and what are our students doing? So are they responding to adult directions? Are they communicating once? And do they have an effective protest? Can they imitate? Can they imitate gestures? Do they have verbal imitation? Can they motor imitate? How are they being safe in their environment? And is the student initiating or responding to peers? So these questions really kind of help us move through our continuum and think about areas that we need to target. And this is kind of a weekly conversation for us Maybe not all 5 questions every week. I mean, for not all students, but this set of driving questions are the things that have helped us kind of move through this conversation in a way that doesn't bog us down into, in particularly the challenges. So for our very young children, you know, there are a lot of challenges with disruptive behaviors and safety and some of these things. And for our teachers and the aides, you know, thinking about this set of 5 questions, you know, and what area do we need to target? So obviously, is student remaining safe in the environment? That could be a very long discussion. But are they making growth in some area? You know, and can we have a solution-focused conversation around something like Ethan's not imitating, or you know, Rosario's not using an effective protest, and then that sends us in a direction to have a conversation about how we can do that and give that student the skill that they're not demonstrating. So next slide. I mentioned the constructs that we're really working under, and it links back to our expectations in our classes and also in our matrix. But these 5 constructs have been something that have been very helpful for us when we're thinking about being inclusive-minded and creating inclusive opportunities. So can the student be safe in an environment? Will the environment meet their communication needs? And if not, what do I need to add to that environment to create an opportunity to maintain their communication needs? Can they be independent with some part of their day? Are there emerging social skills? And are there social opportunities that, again, are high leverage skills? So for example, having a child walk up to another child and say hi, or say hello, or say, can I play? You know, that is a high leverage skill that then, based on how that other child responds back, it creates an opportunity for a whole different set of skills. And then honestly, in this set of constructs, the easiest one that has been something that we've been able to create an opportunity for in any environment is the academic skills. So if I'm targeting standards, and I know that a student is below grade level in certain standards, but they can access in certain ways through accommodations and modifications, at least in our system, what a student's academic skills are has not really been such a heavily loaded construct for placement. Communication, independence, and safety typically have been the 3 high leverage drivers, because I can create opportunities for social skills and academic skills much easier than I can create preventive intervention for safety, for example, or independence. So this is just a framework that we've been using for about a year. It actually started with our preschool team looking at some kindergarten placements that were really very difficult for us to make a decision about what was best for a child going into kindergarten. But these 5 constructs were something that helped us. And I literally put this up. Next slide.
Question for you, if that's okay, before we...
Yeah, absolutely.
So it says there are programs for which children are fully included with severe limitations, service support needs, disruptive behavior, etc., without having readiness capability. How might those differ from this program, from what's being provided there in Singer?
So I'm not sure what the question is about. Say the beginning of the question again about.
So talking about programs where kids are fully included who may have more significant needs,
Right.
that haven't been able to demonstrate that readiness. So how might those programs differ from the continuum that Sanger has?
I think the strength of our program is we still have state and district opportunities outside of special education. So the general education minutes, I think, are protected in our offers for most of our students, except for the students with the most significant needs. The other part would be, I think, the type and intensity of service. To have high numbers or high minutes, to have a student get 3,000 minutes, for example, of intensive intervention, in addition to general education services, in a setting that really they're only there as long as they need to be, has helped us kind of move students through the continuum rapidly. And I think that's what makes things a little bit different for us when we're thinking about, again, these 5 constructs. So thinking about the constructs, this is an example of a slide that we actually use during an IEP meeting, thinking about a placement. And we really hold very strongly to the idea that special education services are not a menu per se, that a parent is just picking what is best. It's really our obligation to make an offer that meets the child's needs, and that we can set some goals that they would work on within the next year. But this kind of graphic has been helpful for us, and it may not be necessary that every construct is met in an environment, and it would be unusual that every construct would be met. Particularly the independence and social skills. If we're protecting those things, then it may be that those are not necessarily met in a general education classroom without extra support for us. Then we have that obligation to build it in. But this tool has been something that parents kind of understand where we're coming from and why we're making the decisions we're making. And this has been something that's been helpful for us as we've walked through these placement discussions. And like I said, and as we've had maybe in a 12-month period where we've had 2 or 3 IEPs, for example, to make a case for, we really feel like your son or daughter is ready for something that may be more challenging than what they were doing just 6 months ago, because kindergarten is coming quickly. So this has been something that's been helpful for us. So walking through using the tools and the continuum that I've been describing, as we walk into the spring and we're getting ready for kindergarten transitions, this year, we have 44 out of 47 of our kindergarten students who are receiving 3 to 5-year-old services are on their way to general education kindergarten. 10 of those students do have an autism diagnosis. Several of them, 7 of them, are from the full inclusion preschool program, and then 3 are from they're getting services in other ways through state-run preschool and through homeschool speech therapists, for example. 2 of the students are diagnosed with intellectual disability, and then 35 have a speech and language impairment disability. And then we've had our exits, which is really exciting for us, which is an area where, that's kind of the idea, or that's our expectation or our hope, is that with intensive early intervention, can a student really no longer show a need and meet eligibility because they have acquired skills that will help them walk into kindergarten without the need for special education services. Without the need for special education services. So this is kind of our reality at the moment. The next challenge for us, of course, is how are we going to support these kindergarten teams as they take on the task now of serving, the incoming kindergartners. And one of the strengths in our program here and in our model here in Sanger, as an RTI and a PBIS district, is the number of psychologists and speech therapists that we have available to our sites. So every elementary school in our district has a school psychologist at least 2 days a week. Many have a school psychologist 3 or 4 days a week. And because of our RTI program here in Sanger and our percentages of special education at the sites, the psychologists and the speech therapists really work hand in hand in trying to help our incoming kinder teachers support the students that are coming to them. So for example, the psychologists that are assigned to the sites where our students with autism will be going are already making visits to the full inclusion preschool or the preschool sites. We're getting ready for those transitions. And the preschool psychologist is collaborating with those psychologists really to help for the smoothest transition that we can. And what are some of the classroom accommodations that are still necessary with visual schedules or flexibility cards or transition slips, things like that, really to help our students with autism be supported. We do have a very small number of students that if safety and independence are a challenge, yet social skills and academics are strengths for them, that would possibly go into program with an instructional aid. That's a very small number of children in our district. Right now, in our kindergarten classrooms, we have 3 instructional aides that are supporting students, 2 with diagnoses of emotional disturbance, and 1 with a diagnosis of autism. But for the most part, our speech and our psychology services have been really able to support those transitions and support those kindergarten students as they're kind of walking into general education. So next slide. This is an example of one of our students that we've had very good success with. And Ethan was a Part C to Part B referral. And he came to us with having received 15 hours a week of in-home ABA, very traditional discrete trial model of services. So academically, he knew all of his letters, all of his numbers, lots of categories, could label many things, but could not use any of that information to request. And so from our C to B referral, we assessed him at 2 years, 11 months, and he did meet eligibility for a diagnosis of autism. We didn't talk very much about our Fresno County Autism Program for preschoolers, our PIP program, but that program really is designed for students that do not have an intellectual disability, and their autism symptoms are really the thing that are driving the challenges that they're having. And so when we did make our offer in December before his birthday, we did make a referral to County Office of Ed for the PIP class. But then we started him in our CARS program 4 days a week, 2 hours a day. And very quickly, the readiness and his connection to the classroom really blossomed. And academically, he was able to do all of the activities. The CARS program really is based on the Preschool Learning Foundations. That is a special education teacher that's writing goals based on the PLF standards. But Ethan really responded very quickly. He was sitting in a group. He was transitioning using his visual schedule. And by February, so just within about 9 weeks, we really felt like on the rubric that he had developed skills so quickly that the full inclusion preschool was an appropriate option for him. Had we not had the CARS class as an option, he would have received speech and language services in the PALS program, and then would have likely been a referral to county for their preschool program. But we were able to withdraw that referral, and then he was in the full inclusion preschool from February of 2015 to August of 2016. At which time he transitioned from the 1 to 15 students to a regular state-run preschool class of 1 teacher and 24 students, as any other child would. And then just last week, we actually, as part of his transition to kindergarten, they did an updated assessment. And although he is meeting eligibility for autism, he really has no need at this time. So they were not able to really identify any goals that would be special education goals for him. And in his case, and I will not take anything away from Ethan, he had a ton of skills, and I would like to think that we just set the framework and set the stage for him to demonstrate those skills. But from the speech and language assessment, he made 61 months growth and 26 months of services. And so we're just really proud of how Ethan is one example of our students that have taken advantage of a continuum of services that's sensitive enough to have a home for every child, as we're moving to more inclusive-minded and inclusive-based settings. So that is just our most recent example. And so he's on his way to kindergarten as a general education student. Of course, we're going to monitor him very closely and should the need arise. But his parents are just so excited for the growth that he's made and the opportunity that he has really just to walk into general education kinder ready. So my kind of take-home thoughts on this really are about moving away from I think, I feel. We are a district that really hangs on 3 tenets: that it's all about the kids, it's all about, don't blame the kids, it's about student learning, and hope is not a strategy. And with that framework and the use of a tool like we are continuing to pilot, we've really been able to quantify growth and do it in a way that's helped us move students to less restrictive environments. And then, you know, if we really think about the constructs and what is really driving most of the growth, I think communication really is the highest leverage behavior to help our kids show readiness. And our PALS program, the PALS program, 2 days a week, an hour a day, or each day, for that continuum of services really has helped as a pivotal skill to help the kids be ready for kindergarten. So next step, again, continuing to work on our communication pathways for consultation between the kindergarten team and preschool. Refining definitions and really defining those 5 constructs. And then continuing to use the rubric in a more precise way. So we can continue to really help identify a need and provide an answer to that need. As we keep thinking about and beginning with the end in mind, which is kindergarten, general education kindergarten is a terminal goal. So that's it. The rich continuum, like I mentioned, I think is this framework of kids graduating into less restrictive environments. And, you know, when we have 2 or 3 IEPs in a year, it's really exciting for us. You know, exciting, and parents are excited because our framework is really designed around them growing and moving towards kinder. So we don't really shy away from having multiple IEPs because those strength-based conversations are going to move us in that direction that we want. So that's all I have.
Fantastic. Thank you, Jason. Now I'm joining you back again here. So I'm going to go to our Q&A and get some final questions here before we wrap up. One of them says, this is exciting to hear. What sorts of training are your SLPs and psychs receiving to support classroom program?
So I mentioned preschool learning foundations. That's really where our program is grounded in. So professional development on PLF. Second step is the Tier 1 social emotional learning curriculum that is through all of our preschools. Assessment, of course, with the ADOS and other tools to identify. And then most of our psychologists in preschool or in speech therapists have been at least PRT trained, level 1. So we have had 2 rounds of training with Kegel and Kegel. One time we all went down there to Santa Barbara. The second time we had a training here. And so those are some of the things that have been helpful for us to equip them with tools that help them.
Great. Thank you. Next question. What happens for students who never demonstrate readiness but should be fully included because they would benefit more from that context versus a more segregated setting?
I think the readiness question really comes down to intensive behavior intervention, and we're building really rich behavior plans. Behavior would not be a reason to keep a student out of a placement. We would push the support that they need and build a plan, and that's really challenging sometimes. You know, that's probably the number one challenge that we face with our teachers is, you know, I'll talk about how they don't talk all day, but those behaviors are just not safe. And really pushing that behavior support to build a plan that's going to work.
Great, thank you. One last look at questions. Anybody else with a final thought or question? Okay. If not, I really want to thank you, Jason, so much for your time, especially when you're feeling under the weather today.
Thank you
so much for this presentation, for the materials. We'll be forwarding that on to you participants via OMS, as well as a survey regarding this webinar. We really want to hear your thoughts. That's the way we can provide the best customer service to you guys out there. So thank you, everyone, for joining us, and we will see you on the next webinar. Thanks so much.
Thank you.